All right. Good morning, good afternoon, and good evening to wherever you are. My name is Mohamed Eltayeb. I'm the founder of 2020 Vision Digital. Today, I have a special guest joining me to talk about something that's always been discussed and we'll always be debating about. Today, we're talking about COVID, an issue that's affected the entire world and is still continuing to affect us in our everyday lives. We'll be speaking today about all issues COVID related regarding speculation, policies, and simply why it's important to be vaccinated. So without further ado, let me introduce Glahnnia Rates, an epidemiologist at the Center for Disease Control and Prevention, otherwise known as the CDC. Welcome to the show. How are you?
Hi, I'm good. How's it going?
It's going well. I hope you're staying safe and staying protected wherever you are. Um, so let's get straight to it. So what is it? What is it actually? What do you do, and how has COVID affected your role at the CDC?
Yes. So, hi again. So, everyone who's going to watch, my name is Renee, or also Renee, and I work for the CDC Foundation for the state of Nevada. Um, I am currently an epidemiologist. I am supposed to be working with chronic disease and special populations and health equity program as part of a new office under the Department of Public and Behavioral Health under the OSC, which is Office of State Epidemiology. However, we're still working with COVID, so I am mostly working with COVID. So that is one way that's affected it.
Hmm.
I've been working with the state of Nevada as far as like infection control and things like that. This will be going on like my second year. I was first hired as an antimicrobial resistance coordinator, and that was for the state of Nevada's antimicrobial stewardship program, or ASP program, right? So we're basically supposed to find ways to reduce the amount of people who were getting antimicrobial therapy and different types of therapy for antibiotic resistant bacteria and things like that in organisms. But that kind of took more of a backseat because people were not staying in hospitals like they used to. So therefore the numbers of people that were getting those type of bugs went down. You know, hospitals were
Right.
turning over people quite quickly because they didn't want them to stay and risk infections. And plus they had to make specialty units for COVID-19 and things like that. So that's changed my role a lot. This is the second role getting into it where I really haven't gotten into as much as what I've been hired for, or what my even job is supposed to entail. So yeah,
Wow.
that's how it's affected it. Yeah.
Wow. And so the city of Nevada, so I mean, do you like as we're now almost to November, it's been a long time in this COVID situation, and we see hospitalizations have been at a risk. In my state of Colorado, it's been alarming. There's not enough ICU beds and everything like that.
Right.
What is your evaluation, of the status of the country's COVID rate? Is it getting better? Do we have something to hopefully look forward to, or is Christmas going to be, locked doors and, repeat of last year?
Yeah, a lot of states are declining in their COVID numbers, their COVID positivity rates, and all this other stuff. Nevada is one of those states. I mean, we were up 16% positivity rate
Right.
a few months ago, and now we're down to, I want to say, about 6%. I want to
Mm.
say, is it 6%? Um, but some other states, unfortunately, particularly like Colorado, vaccines are just not. Vaccines are just not, the way I want to explain it, are not something that are as popular as they should be.
Yeah.
COVID, Colorado specifically has had a kind of history with not wanting to get people vaccinated, and particularly not wanting to get kids vaccinated for stuff.
Mm.
So that's why you see some states that just continually rise and rise and rise, and they don't fall, or they come in these like loopy waves. They'll go down a little bit, right, and then the holidays come, and then everything else comes, and they'll just shoot right back up because people are gathering together. They're traveling more, and they're staying indoors more, and probably in bigger numbers and everything. Yeah. So some states might have a harder time, like Colorado, Alaska, other places too, maybe like Florida. Even though Florida's been doing a little bit better than unusual lately, and that's just because it's really the vaccine numbers, and then mandates. If you're having folks over certain school districts, or maybe governors that are really not big supporters of vaccines, not big supporters of following COVID-19 policies and mandates and masking and kind of staying apart with that distancing and everything, then you're going to kind of see it statistically when it comes to people becoming infected and sometimes reinfected.
Right. Wow. And I mean, just like you said, so, Colorado's had a history of not vaccinated, children. I don't remember how many times I've been vaccinated when I was younger, my younger brothers. But why is it really important for either the young or the older age demographics to get vaccinated? Like, what challenges do you guys face and when, promoting that message to get vaccinated no matter what age you are? I mean, now I've seen that there's been approved, like the Pfizer has been approved to, correct me if I'm wrong, or like for children. So, why is it so important just to get vaccinated and not just depend on your natural body to, beat the COVID?
Well, vaccines basically work in two ways well. And one of that is getting your body to make its own antibody response, right? The same too with mRNA vaccines, right? So those two are going to be your Pfizer and then your Moderna vaccines. And then you have your vector vaccine, right? Which works a little bit differently. Right. But they all going to give you the antibiotic response. Okay. So the other part too is having herd immunity. So if you can get, and now they're seeing at least about 70% of the population to get vaccinated, right? I think we're about 56 or 57% throughout the US and everything right now. Then you have a stronger herd, right? The reason why we're not getting polio or measles or mumps and all this other stuff is because a lot of people are vaccinated and they're vaccinated at early ages and stuff like that, particularly when people's immune systems are compromised and they're learning and everything and they haven't been exposed to too much stuff. But if you don't get people vaccinated, and you stop that process, it makes it easier for the virus to attack people, and particularly vulnerable populations, people that may have underlying conditions, chronic diseases, people who are younger, and also people who are older as well.
Right.
It makes it a lot easier for them to become a little bit kind of, I don't want to say target.
Right. And so, I mean, when I got first vaccinated, in March, and there was a lot of speculation, just like there is right now. Everybody was saying, well, this vaccine has been, it's been developed too quickly. It's only been a year. How do we have vaccines already for the public? So like when being asked that, how do you? Are you still with us? Oh, wait a second.
Targets for vaccines. Go ahead. Sorry about.
Oh, no, it's all good. So I was saying, so you have a lot of people questioning the quickness of the vaccine being developed. How do you answer that to when friends or family or anybody's really asking you like, well, how can I trust this? What is the risks involved? Are there any risks? Because you're putting your body at jeopardy. What is the guarantee here?
Yeah, I think it's important for people to understand that there is no shortcuts taken to making the vaccine, even though it was a faster process, because, some vaccines in the case of like a pandemic, right, they're going to get that emergency authorization, right? And that's what happened in this case. Pfizer got that emergency authorization, Moderna did, and then the Johnson or Johnson vaccine came a little bit later, kind of after that, right? So you have different steps in that process. When it comes to developing vaccines, you have initial development, you have clinical trials, you have authorization or approval, and then you have manufacturing and distribution. And throughout those phases, you have your general stages of your development and the cycle of vaccines. So that's going to be exploratory stage, preclinical stage, clinical development, regulatory review and approval, manufacturing, and then you're going to have your quality control. So the only thing that was kind of expedited in this case really was the administration stage, right?
Right.
Traditionally, with vaccines, you might administer the vaccine and have a longer kind of watch period to see, what are going to be like the side effects for certain things. And then you're going to have much more people, where it wasn't as many people because you needed the vaccine. You needed something like I kind of described it to people, you needed a bullet in your chamber. And since we didn't have anything as far as a bullet in our chamber other than masking and, kind of making sure we follow those guidelines and stuff, that part was expedited, but it was still quality controlled. It was tested for safety and everything else like that. And then, of course, people were also looking to see if they were symptomatic and kind of the responses that they've had. And it's pretty much been the same across the board. Even the reports that I've read from people that have reported things from like, having dizziness and joint pain and nausea and stuff like that. And then sometimes in extreme cases, people have like thrombosis and other things of that nature, but it's pretty much been the same. But it's no different than other vaccines as well. If people remember, if there's people probably still around during polio, vaccine was made pretty fast as well. But this is not underneath the category of an experimental vaccine. This is a tried and true vaccine. So yeah.
Well, that's great to hear, reassuring. Right now there's I don't know if you're a basketball fan. There's a lot of basketball talk regarding outside the NBA. There's a lot of people saying, well, public figures that are saying, my body, my choice. And, their freedom, the mandates aren't really caught, freedom wise, and they're not really looked upon as American. So what is the stance on like my body, my choice when dealing with COVID? Is it the same as every other, stance?
I really understand that my body, my choice sometimes comes from vaccine hesitancy, people not understanding what the vaccines are. People always say read the ingredients, but do most people understand what's in a vaccine?
Yeah.
No, they don't. It's stuff in there that you don't see every day. So you're like, I don't know what this is. I'm not going to inject it in myself. And, I get that from that standpoint and everything. But when we're talking about my body, my choice, sometimes people are, or, maybe against abortion or stuff like that. Or, maybe it's my body, my choice. I don't want to eat healthier, or I don't want to quit smoking. It's my lungs. But right. Those are some things that are going to kind of affect the individual right up front. Whereas with vaccines and, an infectious disease and an infectious respiratory disease, you can possibly transmit that to other people, and that might not be their choice. You can transmit it to people who are under the age of maybe 12, right? They're supposed to be rolling out for 5 and older, right? For vaccines, who can't get the vaccine, right? Or maybe someone who hasn't got a chance to go and get a vaccine. Maybe they're in the hospital. Maybe they didn't have the chance to get it yet at all. Right. Or maybe they just have a compromised immune system altogether or whatever. They've had some past history with allergic reactions to vaccines for mRNA vaccines, and maybe they can't get it, right? Mm-hmm. So you're taking that choice away from other people when you're saying it's my body, my choice. Unfortunately, we live in a society. We don't live out in the middle of the woods. Some of us do. I've seen some YouTubers and people on TikTok do that. But you're around other people, right, all the time. And you just don't know what you're carrying, even if what you're carrying doesn't particularly bother you. Even if what you're carrying eventually gets you to be, asymptomatic. Maybe your symptoms are going to be mild. Maybe you drink some vitamin C, drink and some green tea and you felt better, right? But that might not be for the next person. That could be a death sentence for the next person, or that can make someone become what they call, quote unquote, a long hauler and have these long-term effects from the virus. We have viruses and bacteria all the time. And if you can prevent that, from people getting sick, from helping the virus mutate and become stronger and kind of know, I guess develop ways to become a little bit more well engineered and getting the kinks out and becoming more in tune to being passed on to other people, then you should kind of take that opportunity. I do get the hesitancy and stuff like that because a lot of this is all new to people. When you talk about public health, a lot of people didn't even know what public health was until all the stuff came around with vaccines and viruses and stuff like that. But you really got to look at it from a community standpoint. Individuals on their own, we can't just stop it, right? We have to get to collective as a community, and it has to be at least 70% of us as a whole that are going to go ahead and get the vaccine and be able to protect other people from getting sick, because it affects everybody. It affects public health departments. It affects definitely our hospital system, especially acute care. It affects our elderly people, and then of course those who are younger. So you can't just say it's my body, my choice, because you're taking your choice away from other people, and that's just how it happens, unfortunately.
Yeah, I completely agree with you. It's frustrating to see that, like in the media, and people taking that stance all of a sudden when it comes to COVID. When I think we've reached over 700,000 Americans have died. The rest of the world is not going to get the vaccine until 2022, 2023 because of the horde of vaccines. So how do I per se, how do I, not me, but like, how do people that are viewing this tell their friends, tell their family members, like, get the vaccine, other than, just sending them a link and saying, oh, this is going to answer everything. What other ways can we, conform to the vaccine and being comfortable with the idea of it?
I think we have to realize that in the US, we've been afforded a lot of privileges from being in the US, from being able to take vaccines at early ages, kind of like back to what I say. I think lots of times people get so mentally kind of removed from the fact that you can get sick. There are stuff that exists that you can't see that are around all day, every day. Some of that stuff will make you a little sick. Some of that stuff will make you a lot of stuff and sick. And then some stuff will just straight out kill you. We don't see polio every day. We don't see people affected with smallpox and measles and all this other stuff. We don't see that. So we're so far removed from that. We're so protected, So I think that folks have to come to the decision to say that, hey, this does exist. And whether I like it or not, despite the fact how it got here, despite the fact that the measurements that may or may not have been taken and everything, that you have to make a choice for yourself and your community that you want to get out of this. And the only way to really get out of this and go back to our previously normal, although we probably will not ever have a previously normal like how it was in early 2020 and 2019 and below that, is to get the vaccine. That's just the best way that we can do it. If you don't want to keep doing all these continued mask mandates and all this other stuff all the time, and there's only 3 people allowed in the store, you're just going to have to get the vaccine, because that's just kind of the surest way for us to kind of be protected,
Right. Right. And then, and we also have this flu season coming up. It's getting cold out here. I'm not sure in Nevada, you guys are still warm, but out here it's getting cold. And, with the flu season, why is it really essential to get vaccinated now than, 2 months from now or the next year? What are the benefits of being vaccinated before the flu season comes in?
Are you talking about getting vaccinated with the flu vaccine or
with
just
the COVID vaccine?
Yeah, I mean, flu, COVID-19, all respiratory diseases, right, and everything else like that. I mean, it's important to get a flu vaccine, just like a COVID-19 vaccine, because it prevents you from getting sick, basically. And if you're a person who's in one of those high risk categories and stuff like that, you may even need a booster and all that. Then that's just kind of be the best way to make sure folks don't get sick. It seems to be a trend, even following from last year, that when like probably October rolls around and stuff, and the parties start and people start, getting probably a little bit more loose and laid back because it's the end of the year, they start sharing things more than just drinks and good times. They also are sharing spaces. They're hanging around each other a lot more. They're staying indoors a lot more. They're hanging around maybe larger groups of people, and they're probably traveling a lot more too. So it's definitely more critical, I think, during this time, I don't want to say more than any, you should get a vaccine either way. Especially depending on what your health background is looking like.
Mhm.
But it's very critical that you get it now rather than later. You want to have something that's going to prevent something from happening, whether that's you being symptomatic or you potentially maybe being a long hauler or whatever the case might be, or spreading it to other members of your family or your friends or people at work, or maybe having to have some shutdown at your work. Just get it now and up front, than rather wait and try to see if you can just, be healthy and keep getting your green tea and all this other stuff I hear people here talk about all the time, and amping up on vitamins. Why take that chance if the opportunity is there for you? Especially
Right.
the amount of time that people have gone into for research and medical science, and folks have had time, in these hospitals, between the doctors and the staff and the nurses and everyone, and then people on my side for public health, how we try to educate people. People spend a lot of time trying to keep people healthy. So it
Right.
can't just be us trying to do that as well. It has to be people in the community too.
Right. And with that all said, when you're getting vaccinated, there's a couple options that are there, depending on where you are in the country, or where you are in the world. Is there a better preference? Are they all the same at all the different companies? Um, how does someone choose? Because someone rather say like, I'd rather get Pfizer because it's one shot, versus I'll get Moderna because it's two shots. Um, I think Johnson & Johnson, actually, that's one shot, right? So how does someone go that route?
I say get the shot where you can get a shot. Now, all of them have different efficacy rates and everything else like that. But get a shot where you can get a shot. Obviously the Johnson & Johnson one probably has the lowest of the efficacy rates. But if that's all available that's in your community, that's what you can get. You don't have time to, go back and take the second shot, then you go ahead and you get that shot.
Mhm.
But Moderna and Pfizer, they're both very, very good shots, very good vaccines and everything. So I wouldn't be so, kind of hung up if a person's like, well, I heard the Pfizer's better, I want to get Pfizer, Moderna's
Right.
offer right now, but I just want to wait. Don't wait, go get the vaccine. Just go get the vaccine. Some protection, whether it's either, maybe on the higher end of the efficacy scale or a little bit lower, is better than no protection at all, right? So I would say just go ahead and get it. I'm not going to say one is particularly better than the other, but I will say the Pfizer and Moderna, they definitely do have higher efficacy rates than the one dose Johnson & Johnson shot.
Right. And my last question is, we are hearing booster shots, recently, and there's kind of a split decision between doctors and public health, saying that, well, it's a morale issue. I think we need to first get vaccinated, let the vaccine spread around the world, then we can take our third doses, or it's not needed, because we're reaching that 70% eventually. So will we need booster shots? If you don't have that answer now, I don't blame you, but what is your stance on it?
Yeah, so right now there's only I guess you would say special populations that are going to get that booster shot right now. So those are going to be older adults.
Right.
They're going to be ages 50 to 64 with medical conditions. And then there's going to be residents, those who are 18 years and older, in LTCs or long-term care settings. People with medical conditions, and that's across the board, adults 18 to 49, who are going to want to go ahead and get those booster shots and everything else like that. And then, of course, those who are working in high-risk settings, so they could be in long-term care facilities, skilled nursing facilities, memory behavioral care, acute care, hospital care facilities, community health workers that might go in people's houses or whatever. So, yeah, those people also need to get shots too. So right now, the jury is out. Is if everyone's going to need a booster shot right now. I think public health, and as far as the CDC and the stuff that I have been keeping up on, are just focusing on those specialty populations, people that are either working or living with certain conditions or working in those kind of high risk settings at this point. Yeah.
Well, I mean, I think that reaches our time today, but I think hopefully we've convinced or persuaded someone that, hey, getting vaccinated is a better option than not being vaccinated today. With your, great answers for other questions that we have. I really want to thank you, Glahnnia, for joining us today and giving us your time. I know it's hectic, given what you do, but I really appreciate it. And thank you for really being a part of this. And thank you for those that are tuning in. And, if you have questions, Glahnnia might be able to share her information. We'll see. Or you could always check out Google. So thank you for tuning in, and thank you, Glahnnia, for being really here. We really appreciate it.
Okay, thank you so much. And you can always contact me, or anyone else can always contact me on LinkedIn as well, and shoot me a message or whatever, and I'll be more than happy to reply. So.
All right, well, perfect. All right, thank you guys, and thank you, Glahnnia.
Right, thank you.